For me, health equity means social justice in health. We can work towards health equity by evaluating and raising awareness about policies, attitudes, and practices that contribute to health disparities, and working collaboratively towards changes that improve the health of populations most affected.
Hi, my name is Dr. Nathan Chomolo, one of the founding board members of Minnesota Doctors for Health Equity, and I engage in work to advance health equity because one of the very first oaths we take, the Hippocratic Oath, starts with do no harm. And if we truly mean that and are living up to that as healers, we have to really engage a system that does a lot of harm. And so health equity is first starting to understand how we are complicit with that and what we can do and use all the levers of power and influence we have as physicians to really bring healing and equity to our communities and ourselves.
My name is Beth Rogers. I am motivated to be part of Minnesota Doctors for Health Equity because every time I'm in clinic, I'm reminded of the structures that we have in our system that perpetuate inequities, and it feels like this is one way to do my part to work toward dismantling some of those structures. I also really love the people and am motivated and learn so much every day.
Hi, my name is Ku Pham. I'm the treasurer for Minnesota Doctors for Health Equity. I'm MedPeace trained, also board certified in addiction medicine. I spend half my time at the University of Minnesota Hospital, the other half at MDHEQ Clinic doing primary care. As a refugee, I have interest in immigrant health and their access to care. I also do work around diversity and inclusion with our trainees at the university. I teach and share my experience around structural racism in medicine. And finally, I do research with the community that focuses on culturally centered addiction treatment. If you ever have any questions around this work, let me know, and I'd love to share it with you. Thank you.
Hi, Mark Paller here. The quality of our communities should not be measured by the number of billionaires and art museums we have, but rather by how well the least fortunate amongst us fares. As a physician, I try to give each and every one of my patients the best knowledge and the best treatment available. But even all of my hard work may fail if my patient cannot afford expensive therapies, if she loses her medications during an eviction, or if he is so focused on finding his family's next meal that he forgets about his routine clinic visit. We can and must do better to address the root causes of health inequities in our community. That's why I volunteer with Minnesota Doctors for Health Equity.
Hi, my name's Tom Schmidt. I'm a board member for Minnesota Doctors for Health Equity. I engage in health equity work for a simple reason. It's the right thing to do. Your ability to live a healthy life, your ability to achieve healthy outcomes should not be impacted by your gender identity, by your race, your ethnicity, your location, where you live, or how much money is in your wallet. I do this for my community, I do this for my patients, and I do this for my colleagues.
Hello, my name is Susan Lepke. I'm a board member of the Minnesota Doctors for Health Equity, and I'm also the public policy advisor for AABB. Health equity is important to me, and one of the reasons why I joined the board is because as a public health professional, health equity equals social justice and ensuring that everyone, no matter race, religion, where you live, what socioeconomic status you're in, that you have access to health care. It's important because I am from a family of immigrants, and healthcare was very important when my family moved to Minnesota, and not everyone had access to everything that they needed. And so being part of this board is important to me because I want to ensure that health access is available to everyone no matter what. Health access, health equity is social justice, and public health is social justice as well. And so for me, it culminates and brings together everything that I care about, not only within my family and my values, but also to make sure that I can educate and work with providers in the state of Minnesota to ensure that equity and social justice is brought to everyone. So that is why I'm on the board, and that is why I'm here to bring my talents and to bring my expertise and to also learn from all of you. So thank you.
My name is Ryan Kelly, and I'm one of the founding board members for Minnesota Doctors for Health Equity. I'm a primary care doctor at the Community University Healthcare Center, a federally qualified healthcare center in Minneapolis, where I practice primary care and addiction medicine. I'm also a hospital medicine doctor at the University of Minnesota. My main focuses career-wise right now have to do with improving access to non-biased healthcare for folks who use drugs, as well as decreasing barriers for folks who are unsheltered when it comes to seeking healthcare. I think the main driving force for me when it came to being involved with the Minnesota Doctors for Health Equity had to do with the realization is that many physicians, including myself, really don't spend a lot of time outside our day job working to improve the lives of others. I think we as physicians have a responsibility to use our resources and power to do as much as we can to improve lives. There are many doctors groups focused on making the lives and roles of physicians easier, making the lives and roles of doctors better, working to protect physician resources, etc. Well, that's not at all what Minnesota Doctors for Health Equity is about. What we're about is using our resources as docs to support the people we truly work for, our patients, so that they can have better lives.
I engage in health equity work because I want to live and practice in a world where people truly have an equal shot at being healthy and can focus on the things that really matter to them.
Hi, my name is Arthi Bhatt. I am one of the board members for MDHEQ. I engage in health equity work because in the clinic where I work at, I take care of a very diverse patient population, and many of our patients are affected by health inequities related to structural racism and lack of access to health care and unjust housing policy. And in order for me to fully care for those patients and to help them achieve good health, I must care about health equity and do what I can, organize in my community, advocate at a legislative level, and push institutions to really center health equity.
Hi, my name is Beth Thielen. I'm an adult and pediatric infectious disease doctor and an assistant professor of pediatrics at the University of Minnesota. I joined Minnesota Doctors for Health Equity because so many of the infections that my patients struggle with are a direct result of social determinants of health, ranging from bacterial endocarditis, from injection drug use, to HIV, and now to SARS-CoV-2 infection. I really appreciate the role that Minnesota Doctors for Health Equity plays in advocating for improvements in these health disparities.
Hi, I'm Diti Pandira. I'm an internal medicine doctor at Hennepin Healthcare and the Chief Health Information Officer there. I believe that everyone deserves a fair and just opportunity to be healthier irrespective of their circumstances. My passion is to bridge the disparities gap through innovation, education, and advocacy.
I like to think about two concepts. One is the concept of health equity, and the other is the concept of health justice, which to me means using the framework of health, looking both backwards in time, really thinking about the right now, and then thinking into the future. And what I mean by that is, I think that we cannot really truly achieve conditions by which everybody has access to health unless we're really taking into account what has happened in the past, what has gone on in history that it has either allowed certain groups to flourish or has really traumatized other groups in a systematic way. And then thinking about the present, thinking about, okay, how is our community built? How is our city built? How is our state built? What are the things in our country that are great? And what are the things in our country that really, really need to get better? And then thinking into the future, meaning always having hope and maintaining optimism that we can do better. And for me, that's part of why I wanted to join this group and become a member, because I wanted to be able to really always maintain hope and find a community of people with similar values to me, who also had skills and resources and tools to sit in powerful offices, to meet with legislatures, to write really amazing op-eds, and to sort of be able to learn from that community of activists. And so that's a little bit of the reason why I joined, because to me, thinking about health justice means forming that team and always, always, always keeping a multitude of perspectives, kind of space and time on the table.
Hi everyone, I'm Mike Aylward. I am a MedPeds physician and president of Minnesota Doctors for Health Equity. My clinic is in the Cook Clinic in the Phillips neighborhood, and I'm a primary care doc. I got into health equity really because of the realization that working with patients was important and felt right, but I also felt like I needed to be doing more. And health equity work felt like the right way to enact change in the world. I also have 4 daughters, and I feel like I need to show them how to respond when the world isn't going in the direction that we all intended to be going. And so they call this my doctor group. But it's much more than that. It's obviously not just about doctors, it's about all of us pulling together to try to make the world a better place.
Hi, I'm Beth Hoffbauer. I am a MedPeds doc with Alina, and I joined Minnesota Doctors for Health Equity because I believe that the pursuit of a healthy life is a human right, and I wanted to be a part of a community that's committed to removing the barriers in ourselves and the systems surrounding us for people to be able to live that out to the fullest.